Hello everyone, welcome to my presentation. First of all, let me thank you all for coming here today. Let me introduce myself. My name is Tsania Putri Fathiniyah. I'm a PhD student of Anthropology at Airlangga University in Surabaya, Indonesia. As you can see on the screen, our topic today is the dental traits of Indonesian Javanese. Today's topic is of particular interest to those of you who want to know more about the characteristic of Javanese people. The purpose of this presentation is to let you know more about the dental traits of Indonesian Javanese. I've divided my presentation into three main parts. First, I'd like to give you an overview of characteristics of teeth in several groups in Java. Secondly, I'll focus on explain the percentage table of the characteristics teeth in Javanese people. And thirdly, I will explain the conclusion about this topic. It will take a little bit your time to cover these issues. I can email the PowerPoint presentation to anybody who wants it. If you have any questions, feel free to interrupt me at any time. Have you ever wondered why there are so many differences between Javanese teeth? Or have you ever noticed it? Well, if I could show you about the characteristic of Javanese people's dental, would you be interested? And did you know that dental variation is heritable? The traits appear to be controlled by multiple genes, and they are little influenced by environmental factors. So, let me first give you a brief overview. Scott and Turner in 2000 have divided the world's populations into 5 groups based on their dentitions. The dental traits of South Pacific group exhibit dental characteristics such as frequent expressions of cusp 5, Carabellis cusp, and cusp 6. In contrast, there are rare expressions of winking, shoveling, double shoveling, interruption grooves, and cusp 7. Further, they have intermediate position for several traits such as odontomes for cusp LM1 and LM2, LM2Y pattern, and deflecting winkle. And in the next slide, the Sino-Americas group, according to Scott and Turner in 2000, has characteristics of dentition such as high frequency of winging, double shoveling, interruption grooves, odontomes, cusp 6, and deflecting wrinkle. The Sunda Pacific groups have no high frequency dental traits that set them apart. However, they have high frequency of cusp 7 and 4 cusp LM1. This brings me to the end of my first point. The summary of the point is on this slide. This leads directly to my next point. As I said earlier, I will explain to you about the percentage table. Let's now look at the next slide, which shows percentage of shovel and double shovel shape. From table 1, we can see that in the present sample, shovel shape was common, although the expressions were mostly grades 2 and 3 using the ASU shovel-shaped dental plaque. It was also noteworthy that the frequency of the sample that did not have shovel-shaped upper incisors was comparatively high, 8% to 9%. Some subjects have slight double shovel. Let's now move on to the next slide. As you can see here, there are TD, IG, and LI. From table 2, we can see that incisor winging occurred in 15% of the present sample. so it's comparable to the Sunda Pacific group as described by Scott and Turner. Expression of tuberculum dental was weak to moderate, and most individuals, 47%, lacked tuberculum dental on their central incisors. However, interruption grooves on the upper second incisors occurred in only 12% of the current sample. Upper lateral incisors can undergo rotation, crowding, or reduced size, and the uncommon shape or placement of lateral incisors occurred in a small number of the sample. It's 2%. Let's now take a look at the next slide. I'd like you to look at the percentage of distal accessory ridge, or DAR, and the Bushman canine. From Table 3, we can see that canine distal accessory ridge occurred in 69% of the sample. Now, let's look at the next slide. As you can see here, there are trait percentage on the upper molars. From Table 4, we can see that Carabelli's trait complex was expressed more than 70% of the case, with the degree of expression ranging from 0 to 7. The parastyle occurred on 2% or M3 to 6% or M2 of the molars, while no parastyle nor cusp 5 was found on M1. Take a look at the last table in the next slide. As you can see here, there are percentage of traits in lower molars from Table 5. We can see that the groove pattern was mostly of the X pattern. Cusp 6 was found in 6% of the sample, and no cusp 7 was found. Most of the sample, above 90%, had no deflecting wrinkle or anterior fovea. The prostylid occurred predominantly on M1, with a frequency above 50%. As a final point, I'd like to give the conclusion of my presentation. Based on the finding in this Javanese sample, the trait frequencies were more like Sunda Pacific. The Sunda Down people who have higher frequency of derived traits are thought to have evolved on Sundaland during Upper Pleistocene. They exhibit a more conservative pattern, typified by trait retention rather than elaboration. The traits with frequencies similar to the Sunda Pacific group were shoveling, double shovel, winging, and tuberculum dental. However, other percentages mirror those of the Sino-Americas, and still others those of Sahul Pacific. Trait frequencies similar to Sino-Americas were cusp 5 and the Y pattern. Percentage similar to Sahul Pacific were interruption groups, cusp 6, and deflecting wrinkles. Consequently, the sample of Javanese is not monolithic as regards either the Sino-Don or Sunda-Don dental patterns. Instead, they exhibit some features of each, probably because of the millennia of human migration through this region. Based on the figures we have, I'm quite certain that there is a lot of characteristic dental on Javanese people. Thank you for your attention. I hope you will have gained an insight into my presentation. And if you have any question, please drop in the comment. And the last I'll say to you, always read the book and practice so you can achieve your goal. Keep studying. Once again, thank you, and see you in the next presentation.